All right. Good evening. My name is Sarah. I'm going to be your nurse practitioner student today. We're going to be doing a full physical assessment. So first I would wash my hands before I came in the room because I'm going to be touching you. And is there any questions that you have?
No.
Okay. I'm going to start with your head first.
Okay.
So I'm just looking to see, make sure there's symmetry. You're not having any lesions, nodules, anything like that. Sorry, my hands are cold. I'm going to feel your scalp. Everything's symmetric. I'm just going to take a look at your jaw muscles. Can you open and close your mouth? Move from side to side. Good. And then that is a test. Let me grab my other thing. Of your cranial nerve, your trigeminal nerve. And another one is I need you to close your eyes. And let me know when you feel the cotton swab.
Oh, right here.
Okay, can you open your eyes? One more is your corneal reflex. I'm not going to touch your eye. I'm going to get kind of close to look for your blink. Okay. Another cranial nerve that I need to test on you is your facial nerve. So with that, I'm going to have you close your eyes real tight. Open them back up and raise your eyebrows. Smile. Frown. Puff out your cheeks for me. Good. Next, I'm just looking at your eyes. I'm looking at your mucosa here. I'm looking at your lacrimal ducts and your pupils. No redness, no drainage here. Everything looks good. Any issues with your eyes or vision?
No.
Okay. So what I'm going to do now is for your optic nerve, what I need to do is check your visual fields. So first I'm going to have you just kind of look straight at me. Do you see any double vision? No, just look focus.
Okay.
Any double vision or blurry vision or anything?
No.
I'm going to check your peripheral vision, so look straight ahead. I'm going to bring my hands towards you, and then let me know when you see them.
I can see them.
Okay, what numbers do I have?
Okay, I can't see them back in. Okay, 2, 3.
Yeah. Got it. Next, I am going to check your your pupil reflex. So look straight for me. Good. Good. Equal. Good. Now I'm just checking the convergence. Good. Another test is for your oculomotor, your trochlear and abducens, the cranial nerves 3, 4, and 6, and that is for eye movement. So follow my finger with both your eyes. Perfect. Also looking for nystagmus. Good. Next, I would do a fundoscopic exam with the ophthalmoscope. First, I would look in her left eye with my left eye. You just cover your. Good. So I'd flash my light in her eye, and I'm looking for her optic disc, her retinal vessels, looking for any hemorrhage, papilledema, the red reflex, and that's it. On the other side, we look with the same eye, looking for your optic disc, your retinal vessels, any hemorrhage, or papilledema. Nothing. Good. Next, what I'm going to do is your ears. So, I'm just first going to look for symmetry here. No redness or drainage on both sides. There's a piercing on this side. Any tenderness here? No. Good. So what I would do for her otoscope test, I would look on each side and pretend like I'm doing it. And then I'm looking for the tympanic membrane, looking for the cone of light, and looking to make sure the disc isn't bulging. There's no exudate in the internal canal, no redness or any bleeding or anything. So then I'll come to the other side. Same thing. Look inside. I'm looking for her tympanic membrane, the cone of light. Looking for any edema or drainage. There's nothing here. So for your hearing, there's a couple things that we do. First is a whisper test. So I'm going to have you cover that side. Yep. I'm going to whisper 2 things to you and you let me know what I'm saying, okay?
Mm-hmm. Purple.
Okay.
Wednesday.
Good. Next.
86.
And
Fire.
yep. Okay. Then with a tuning fork, which I don't have, I would do the Rin test, which I would strike the tuning fork, and we're listening for, or well, we're not listening, you're listening, for the vibration of the sound. And then I'm looking to see if it's better through air conduction versus bone conduction. So first I would strike the tuning fork, place it on the mastoid process back here, and then you would tell me when you stop hearing it. And then after that, I would switch it to air conduction, which should be longer. And then I'll go around to the other side. Same thing. Mastoid process. And then air conduction. And then the Weber test is again with the tuning fork. So you'd strike that, place it on the top of the head here. And she would tell me then she hears the vibration equally on both sides. Okay. Grab my... Next, for your nose, I'm just taking a look on the outside. Any tenderness or anything? How about if I tap on your sinuses? No? Good. Okay. I'm going to take a look inside. I'm looking at the mucosa inside, make sure there's no bleeding or lesions or anything. Also looking to see the, what am I looking for? Oh, septum. Good. A little red on this side. Alright, good. Next, your mouth. Have you open your mouth for me? Can I take a look? Good. Now I'm looking, stick your tongue out. I'm looking at her tonsils, her soft palate, hard palate. Put your tongue to the side. Her teeth look intact. Tongue looks all right. Good. Can you swallow for me?
With my mouth open.
No.
Okay.
Just go. Okay, good. Now stick your tongue out and say ah for me.
Ah.
Uvula rose. For the cranial nerves, 9 and 10, the glossopharyngeal and vagus, we usually test with gag reflex, but we're not going to do that now. Now, for your hypoglossal nerve, I'm going to have you stick your tongue out again and move it from side to side. Good. Now, oh, I did forget your olfactory nerve, which is for sense of smell. Can you smell that? Okay. Next, I'm going to move to your neck. Take a look on both sides and from the back. No swelling, no lesions or anything. I'm going to feel for your lymph nodes first. Good. Occipital, pre-auricular, post-auricular, tonsillar, superficial, cervical, good, and deep. And then subclavicular, good, submandibular, and submental. Okay. I want to do a couple tests with your muscles of your neck too. So for your spinal accessory nerve, we want to check your shoulder and neck movement. So against resistance, can you shrug your shoulders for me? Good. You turn your head that way. Good. Good. Now a couple extra range of motion. What I want you to do is for flexion, chin to your chest. And then flexion is look up. And then abduction on each side. Good. So for your back, I'm just going to first take a look. I'm going to take this back. And feel your spine, your cervical spine, thoracic, and lumbar spine. Any pain or tenderness. Also feeling the muscles back here. Good. For now. What I want to do right now is to take a look at your upper arms. I'm just put it up. I'll lift it up. First, I'm just checking out your joints. Any pain when I'm touching here? Okay. Your elbows, the lateral and medial epicondyle, the acromion process up here, the wrist joints, and then over your hands, metacarpals. Well, carpals, metacarpals, and phalanges. Okay, let me just take a look on the other side now. Any pain or anything? Okay. Good. Okay. So, what I first want you to do is a couple range of motion exercises for me. So first, for abduction, you raise each arm out. Good. Good. Now against resistance for me. Good. Okay. I want you to raise both your arms up above your head. Good. Now back. Good. Can you put both your hands behind your head like this? That is external rotation, internal rotation, hands behind. Good. I'm going to take a look at your elbows, the flexion and extension of your elbows. So first, yep, you press against my hand. Good. Now, good. Can you put them straight up and supination, pronation? Good. Now your wrists. Yep. Flexion, extension. Can you press down? Good. Eversion is out. Yep. Wait. Eversion, inversion. Eversion out like that. Yeah. Okay. Now for your hands, I want you to make a fist. Good. Extend them out. Spread your fingers out. Abduction, adduction in. Good. Squeeze both my fingers here. Good. For opposition, touch your thumb to each finger. Perfect. I'm going to test your reflexes also. Okay. And then while I'm here, I'm going to feel your pulse too. Good. Okay. First, it's supposed to like flex open there.
Okay.
And then here, I just don't want to hit you so hard with this one. Okay, this side. And then relax here. Okay, now I'm going to do your triceps right here. Relax your arm. Okay. Rest your arm on the hand. Okay. Okay. Good. I'm gonna do some sensation tests also. So you let me know. I'll show you first. I'm gonna do this one is dull. This one is sharp. And then light. Okay. So close your eyes. I'm gonna do it on your upper body first.
Sharp.
Good.
Dull, soft. Dull.
Good.
Sharp. A feather. Dull.
Good. I'd also check vibration sense with the tuning fork on the bones. Well, not on the bones, but of the thumb on both sides. For your lower extremities, let me see if this is a good angle. Okay. So first, I'm just gonna take a look at your knees and legs. Sorry. And your feet. Let me take your socks off. Thanks. Okay. So first I'm just checking for any pain or tenderness.
No.
No swelling. No edema, no erythema. Temperature's good. Let's see. I don't see any issues with vascular system, no varicose veins or anything. So what I want first for your knee, actually, those I'll mostly test while you're standing. Can you actually first lift a little bit and out and then in? Good. Other side. And then check, scoot back just a little bit. Good. Your popliteal reflex. This is not a high enough chair, but if you were dangling. Good. And then Achilles. Good. I'm going to feel the pulses of your feet also. Okay. I'm going to do the same thing that we just did with the soft, dull,
Okay.
and light. Do you need me to
No.
show you? Okay.
Dull.
Yep.
The feather. Sharp. Dull. Dull.
Okay, good. For while you're seated, I'm gonna do a couple tests for. Okay, can you sit back a little bit so your feet are just a little raised? Yeah. I'm gonna do flexion down. Good, and try to press against my hand. Good. And then up, and try to press. Good. And then out. Oops. And then in. Yep. Now your toes, just spread them out. Good. Let's see. Another thing I would do for that vibration test again for sensation with the tuning fork. I'm also going to test a Babinski reflex. Yep. Thanks. Good. Negative. Let's see. I think I did that. Okay. Now, as part of our assessment, we do a small neuro exam. So, can you tell me where we are right now?
At my house.
Okay. And what year is it?
2015.
And what's your name?
Michaela.
Let's see. Can you tell me what you did today?
I clean the house and I went grocery shopping.
Okay. And what schools did you attend?
Our Lady of Good Counsel, Ladybud, Michigan State, and Madonna.
Okay, good. And I know that's right. Another test while you're seated, we're going to test a little bit of your cerebellar function. So can you hand yep, as fast as you can. Okay, even. And then for me, I'm going to hold my finger here. You do finger to nose. But I'm going to move my finger still. Looking for tremors. Good. Can you tell me what it means when people say that people in glass houses shouldn't throw stones?
Because they'll break.
Okay. And then can you tell me... Oh, wait. Can you count back from 100 by 3?
97, 94, 91, 88, 85.
Okay, good. Another thing I need to test is your position in space. So I'm going to borrow your feet. Close your eyes for me. So I'm going to show you. This is up, and this is down.
Mm-hmm.
Up, down. So I'm going to move your toes, and you tell me which way it's moving, okay?
Mm-hmm. Down. 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 Up.
Okay, good. There's another test I need to do where it's object recognition. So I'm going to place an object in your hand, and you tell me what it is. Close your eyes.
It's a Q-tip.
Mm-hmm.
It's a bobby pin.
Yep. Good. So now I'm going to check out your respiratory system. Can I first have you? I'm going to test. Look at your back. Check for symmetry. Looking at your AP diameter. Make sure you don't have any excess air trapped in there, as with COPD. I'm going to first palpate for tactile thermometer, which you need to say.
Hold this foot, right?
Oh,
Will that be
okay.
helpful?
Does it move?
Yeah.
Oh, yeah. Perfect. Can you just say 99 for me?
99.
Good.
99. 99. 99. 99. 99. 99. 99. 99.
Good. Okay. And then I am going to percuss the lungs back here. Side. Okay. Now I'm just gonna listen. You take a deep breath for me. Good. Good. I don't hear any wheezing or crackles. Deep breath again. And down here. Good. I'm going to also listen to your heart while you're seated. Okay, this is pulmonic area, aortic, Erb's point, tricuspid. Thanks. My job. And I'm gonna listen with the bell. Sorry, pulmonic, aortic, Erb's point, tricuspid. Okay. While I'm having you sit, I also earlier forgot to listen to your temporal and carotid arteries. Just listening for bruits. Good. Nothing. Good. Okay, next I'm going to have you lay down. So we'll move to over here. Thanks for being such an excellent patient. Perfect. Okay, I'm going to listen again to your heart sounds.
Do you want to listen to your
So I'm not covering it. Oh, yeah, that's fine. Pulmonic, aortic, Erb's point, tricuspid, mitral. Again with the bell. And then I'm going to feel for your point of maximal impulse. And then listen. Okay. And I'll feel now in all these locations for any throws or heaves. Okay. I'm going to take a look at your abdomen now.
Okay.
Go lift your shirt, okay? Okay. I'm just looking right now for symmetry, no bulges. I can't see any peristalsis or movement. Now I'm just going to take a look, or listen. Listen in each quadrant for bowel sound. Good. Everything's moving. Listen for your aorta. Good. Listening to renal arteries. Listening for bruits. Iliac arteries. And femoral. Feel for lymph nodes too. Good. I'm just going to percuss your abdomen now. Good. I'm gonna do some light palpation and then deep palpation. Any pain? I'm just looking over your bladder. So for the deep palpation, I'm gonna first start pressing, then I'll have you take some deep breaths, okay? I'm gonna first outline the liver and then feel for it, okay? Take a deep breath for me. Like that. Okay. Feel over through the spleen now. Deep breath. Okay. And then palpate the kidneys. Again. Deep breath. Okay. Okay. Good. So for your lower extremities, I did a couple exercises with the knees and ankles and toes. So I'm going to check your hips. So for that, I'm going to have you first do flexion, knee up to the chest. Good. Back. Good. And do it against resistance again. Try to push your hands back. Good. Can you like scoot just a little bit? I don't mean to pull it. So for abduction, I'm gonna have you swing your leg out. This one first.
This one, this
Yeah,
one.
out and then across your body. Good. Against my hand. Good. And then on the other side. Good. Good. All right. Oh. Okay. Good. Now I'll have you stand up. Let's see how this is. Okay. Stand up for me. So for flexion of the knees, just do like a squat. And then back up. Good. Next, we're almost done. For your spine, turn to the side for me. For range of motion, I'm going to have you bend over for me. Good. I'm going to also check your spine. No scoliosis or anything. Up for me. And then to each side, do like a lateral bend. Yep. And then twist. Good. Perfect. Now I need you come back this way. Walk, just walk across to like the end of this rug. Good. Now turn around, walk back on your toes. Good. Then walk back on your heels towards that end. Good. And then the last thing finally is Romberg test. So stand this way. Yep.
Facing you?
Yeah, just face me. And then stand close like this. Good. Now I'm going to come over here. Close your eyes. I'm looking for extra swing or movement. Nope, good. You are all set. Thank you so much.
Thank you.